Hey, Dr. McCarthy, thanks for helping me answer some commonly asked questions. I thought this would be a helpful um, discussion to have just to help other physios in the area or just the general public with answering some of the common questions around concussion.
Sure.
So could you start by just explaining who you are?
Sure. So I'm Dr. Matt McCarthy. Work at the Sports Neurology Clinic in Brighton, Michigan. I am a pediatric neurologist, but also did additional training in sports neurology, dealing with concussion, post-concussion syndrome, and other neurological concerns in athletes.
Great. So in your own words, can you define what a concussion is?
Yeah, so concussion is a brain injury that is caused when there's either a direct force to your head that causes that force to be transmitted to your brain, or a force to your body that is also transmitting enough force to your brain to cause an injury. It's not an injury to any specific part of the brain. It's more of a diffuse injury that tends to cause network disruption. So your brain doesn't have its normal, can't function like it normally would. Best way to think about it is like a traffic jam or bad Wi-Fi signal or bad cell phone signal. There's just not the normal sort of network connections that your brain is used to making. But it is a temporary injury. It has a beginning, has an end, and completely recovers.
I think that's the important part for people to understand. What changes in your management of concussions when you look at an athlete in preseason baseline testing versus the acute injury sideline evaluation, and then someone that presents to you in your office 8 weeks after having a concussion?
So for us, it's always helpful to see somebody before an injury happens, to have sort of a baseline of what that person's like, what type of symptoms do they normally have in their day-to-day life, what is their prior exposure to sports and to injuries, what kind of tendencies do they have based on other diagnoses they might already carry, what sports are they playing, and then going forward in the future, how long are they planning on playing that sport, at what level, playing what position. So gathering all that information up front helps you understand that person better. So if you do need to see them later for an injury, or as you're following them over their career, you can monitor those things. But also gives you a chance to answer questions for them, educate them, talk to them about concerns they might have or misconceptions they might have about concussion or brain injuries. When we see somebody for acute concussion in the clinic, having that information, you're able to compare, use it as an additional piece of information that helps you decide whether you think concussion is the right diagnosis or whether you think other things could be contributing to their symptoms, and help you come up with the most comprehensive plan for that individual person. Seeing somebody right after an injury when you're dealing with acute concussion in the kind of stage of the process where they're still injured is different from seeing somebody several weeks out where symptoms last, like a post-concussion syndrome situation, because the focus in somebody who is far out from their injury and you think the injury is recovered but they're having symptoms as a result of other things requires a more active rehabilitation approach that really needs to be a sort of shift in how you're thinking about that person, because symptoms at that point are unlikely to be related to the brain being injured, but the brain needing to be actively rehabilitated.
So on that note, if I had a child who had sensitivity to light and noise after having a concussion, should I recommend that individual to wear sunglasses to help block out the light in order to protect the brain, or earbuds to I can see you're moving in your chair because I think you get this question a lot, or having earbuds to protect like the sound. Is that a good approach?
So initially after an injury, one of the things we want to do early on is sort of do whatever we can to improve people's symptoms. And so in some cases early on after the injury, when people are having a lot of sensitivity to light and noise, doing those things for comfort in the first couple of days is a reasonable thing. But once you're beyond that early stage, you want to have that person start to move away from that and get accustomed to being in the normal amount of light they're going to be in on a day-to-day basis, being around the normal environments and sounds. Because over time, if you are if you're avoiding things and you're isolating yourself, your brain gets used to that low level of light, that low level of sound. And then when you try to return to normal levels of light, normal levels of activity and sound and noise, you're going to be sensitive to it no matter what if you've been avoiding it for too long of a time. And so there's a right way to do it early on where it can help people feel comfortable initially, but it's something we don't want people to become dependent on. We don't want them to use it as a long-term solution because, especially in kids, they need to be in school, they need to be around people, they need to be active. That's their normal state.
Makes sense. Symptom checklists are sensitive for concussion screening, but not good for clinical care. They may do more harm than good. Why?
I think the symptom checklist can be a good starting point, but when you think about a symptom checklist, first of all, the number of things on a symptom checklist for concussion that can be caused by a ton of other things is all of them. So every single symptom on a concussion symptom checklist isn't exclusively concussion, but can be caused for any number of reasons. So often people look at the concussion symptom checklist and think that every single thing being circled is necessarily related to a concussion, not thinking about what other things could be causing those symptoms. And also if you take a person who has a concussion, they're worried about it, and you're sort of sticking a symptom checklist with all these symptoms in front of their face every day, making them fill it out, asking them constantly about their symptoms, it's going to make them overthink and overanalyze. Do I have that symptom? Do I not? And really the concussion checklist, the symptom checklist can be a starting point, but really it doesn't replace taking a good detailed history that gets into not just what the symptoms are, but how they've been evolving, what's the actual characteristics and features of that symptom. Because that really gives you the information you need to figure out what the symptom is coming from. Is it related to the injury? Is it related to something new that's going on? Is it related to something else that happened at the same time of the concussion? And oftentimes people rely on the checklist as the only thing they're doing. But really, taking your time to do a good clinical history is going to be more effective in every case.
Totally. Can you describe the different degrees of certainty when diagnosing a concussion, and what some differential diagnoses can be kind of related to that last answer, like with the different symptoms
Sure.
Being related to different conditions as well?
Yeah, so the gold standard for diagnosing concussion is still clinical history and neurological exam. There are lots of other tests you can incorporate, lots of different things you can do that can sort of be used to gather additional information to have supporting evidence in either direction. But ultimately, there's no one test or no one thing anyone can do that 100% tells you, yes, this is concussion, no, this isn't concussion, especially because there's so many things that have overlapping symptoms with concussion. And so whenever we're talking about an injury, we like to talk about the certainty with which we're making the diagnosis. And so based on looking at what was the mechanism of the hit, how much force we think was actually involved, what did that person do right after, what symptoms were they feeling, how did that evolve over the next hour, how did it evolve over the next day, how did it evolve over the next few days. And so diagnosing concussion isn't necessarily something you can do right on the spot, on the sideline when an injury happens, but it's something that sometimes takes time to really fully develop. And so we kind of have three categories we'll talk about. One is a definite concussion where there's an obvious mechanism, symptoms that the timing makes sense and can really only be caused by concussion. There's nothing else that could be causing those symptoms for that person. A probable concussion is when concussion is at the top of the list. We think it's the most likely thing causing this person's symptoms. The mechanism makes sense. There's symptoms that make sense, but there are other things that we're also considering that could be causing the same symptoms or some of the symptoms. And then there's a possible concussion. That's the same scenario where it's one of the things you're considering, but in this case, there are other things that you would put above concussion as more likely diagnoses, and concussion is just a possibility. That's something we talk about just with other clinicians, with other healthcare providers. We talk about it with the patient, but really what ultimately matters is whether you're going to decide to treat the person as concussed or not, and how you're going to sort of manage their injury and sort of return them to their activity. But there are a lot of times we'll have people sent to us already diagnosed with concussion, and when we look at video of the hit or description of the hit, we listen to the symptoms, we find other things that are more likely to be causing it than concussion. Something like a post-traumatic headache, a cervical strain, sometimes a migraine, sometimes it's related to there was concern over the hit and person went to the ER, sat there all night, and then their parents woke them up every half hour for that night, and they woke up the next day and they were out of it and foggy and tired. But that was entirely because they didn't sleep the night before. So it's basically gathering all the clinical information that you can. Every piece has to be kind of like taken as a whole picture, and then trying to sort of talk about how certain you are about that diagnosis.
I think that you bring up a good point about the sleep as well, because I think it's still common for parents to have heard in the past that it's important to wake your child up throughout the night, or anyone that's concussed frequently, and those thoughts have changed over the last few years, but it's still, there's a lot of confusion around that. So the recommendation currently is that...
Yeah, the reason for that recommendation is the concern that rather than concussion, there's a more significant injury, something like bleeding or a stroke, or sort of swelling in the brain that's kind of not concussion, but a more serious injury. And really that time period that we're worried about, something worse could be going on. Really within the first 4 to 6 hours, that should declare itself if that's what's going on. And so observing a person for any sort of focal neurologic deficits, for any signs of decreasing level of awareness and responsiveness, any other more concerning signs, that's the reason for that. Beyond that period, there's really no benefit to actually waking that person up and checking on them. And in most cases, it just leads to them being really sleep deprived and feeling even worse than they would have already the next day.
Right. Okay. To jump to a different topic, what is a subconcussive hit, and can you explain CTE to us?
Sure. So subconcussive hits, people are talking about that a lot more now. And really the thought behind that is it's not necessarily the number of injuries people are having, but the overall total number of hits they're having over the course of their life. So these are, hits that aren't necessarily causing immediate symptoms or causing injuries, but the accumulation of them over the course of your life can add up to problems in the long term. CTE is something that gets a lot of media attention, and in the media reports, it's often talked about as a thing that we fully understand and have a complete sort of picture of what it is and what causes it and what it causes. The reality is that it's really still in the early stages of defining what it even is. And the common thing that people tend to associate with it is that it's this neurodegenerative disease that there's really no cure for, it causes all these problems and there's nothing you can do about it. When in fact, the symptoms that people attribute to CTE, we don't really know if that's what's causing those symptoms. And those are common things that people see just over the course of their life in the general population. Things like headaches, sleep problems, difficulties with mood, depression, anxiety, all those things are really common. And more importantly, they're all very, very treatable. There's effective treatments and ways to manage those symptoms. And so I think the most important thing is that we don't really understand what CTE is at this point. But if somebody's having those problems, talking about it in a way that emphasizes that there are other things that cause those symptoms, and those are more likely than not the cause in this person as well, and that there's ways to treat them.
Right. Okay. So obviously medical management and return to sport decisions in sport have been under a lot of scrutiny because of a lot of the media stuff that we just talked about. One of the biggest things I am taking away from observing you guys over the last couple of days is that an active approach is acceptable even if a patient is having symptoms. A lot of suggested protocols out there require that the patient be symptom-free, return back to complete rest if symptoms do come on with activity before advancing a patient along the return to sport protocol. I have read a little bit about your BRAIN approach, the acronym BRAIN. Can you kind of explain this and why it is safe to have an active approach with a symptomatic patient?
Yeah. The first thing is that, symptom-free, that concept of symptom-free, most people in their day-to-day life aren't symptom-free. If you have some, if you have a group of healthy people look through a symptom checklist for concussion and ask them in the past week, have you had these symptoms? A lot of people will have some of those symptoms. So being completely symptom-free is really not a realistic thing for most people. And then there's a difference between exercise, right? Returning to exercise, returning to exertion, and returning to risk of another injury. And so I think, the concern is always that symptoms equal injury, which is not always the case, but also that if you're having symptoms, it's making your injury worse, or it's putting you at risk for a worse injury. And really, we find that people who get taken away from their normal activity, people who get shut down and sort of unplugged from their normal life, that tends to actually make their symptoms worse. That tends to make their symptoms last longer. Getting people back to their normal routine, their normal activities in a safe way early on is, we find, very effective for helping people feel better sooner. And the key is that not all symptoms are the same. So it's not just enough to say you have a symptom, you need to stop doing that. It's what is that symptom? How severe is it? Are you comfortable still? If you stop for a couple minutes, does it go away and then you can continue? So there's a lot of ways to get into the sort of specifics and details of every symptom that each person's having. You have to take kind of an individualized, comprehensive approach. So the brain protocol is meant to just give a general sense. So brain standing for bike, run, agility, in red, which is non-contact sports, and then no restrictions. That's the goal of that is to give a general sense of the progression from more simple exercise all the way to kind of complex sports participation. But really it shouldn't be followed as like a rigid protocol. It's giving you a sense of you need to progress from something simple to something more advanced, adding in the complexity and the intensity along the way. But every person's going to be different based on what their usual training is, what sport they're going into, what position they're playing in that sport. So you have to take kind of an individualized, comprehensive approach to every single person and make it customized.
Totally. My next question is, it's no secret that concussion awareness has increased dramatically over the past few years, and so have the media stories, some calling contact sports a form of child abuse. The other day, I heard a concerned mother ask you, would you allow your child to play tackle football at age 10? Can you repeat the answer you gave her for me?
Yeah, in every single case like that, it's going to be different for every individual, different for every family, every person, but also every team, every coach. So I always say that the first important thing you need to do is ask sort of who's going to be the coach of the team, what's their philosophy of coaching this sport, how are they running practices, how much tackling and hitting is there in practice, what's their response to injuries, what kind of background do they have in terms of understanding how to sort of respond to an injury and manage injured players, but also looking at things like, well, who's available if I do have a concern that an injury occurred, who would I go see in our community, who is a person I could talk to beforehand, establish a relationship and have sort of a baseline with just in case something does happen. So I think gathering all that information, finding out the specifics of that team, that community, and it's going to depend for the kid. There are some kids who would only want to play football. There's nothing else that could replace it for them, whereas there are other kids who maybe there are other sports that they like just as much that don't have as much contact risk. And so, the sort of overall risk is something we still can't completely quantify. We can't predict if people are going to have problems. We can't tell you for sure how much risk there is, but it's about gathering as much information as you can, knowing the benefits of that sport, the potential risks, and giving parents all that information to help them make that decision for themselves.
Yeah, that's a good point. Besides that aspect of having like the right people involved with that decision making, what about the child themselves? Do you think that there's a purpose behind having some physical screening before going into tackle football? Because at those ages, kids tend to be all shapes and sizes, and I think there's a bit of research being done on like having appropriate core stability in order before performing like contact sports when that is being introduced, just so that if you have like weak core stability and balance and all those physical attributes, does that have an effect on your overall risk? Because you can topple over easily or...
Yeah,
those sorts of things.
I think that looking at every individual kid's physical maturity, their athleticism is important before they're going into playing any sport and trying to figure out if it's the right sport for them, the right timing for that sport. And so there's no exact answer or exact thing that can screen out who should and shouldn't be playing. But I think that in a general sense, you have to look at, is this person physically mature enough to be playing this sport? And then what alternatives are there? Is it something where playing flag football until they grow or kind of have some more core stability or neck stability so learning the sport, learning the skills before they are kind of having the contact part of it. So I think that's definitely something to consider.
How does the management of a concussion and return to sport differ when you're dealing with a child compared to an adult?
Yeah, I think in kids, the tendency is always to err on the side of being more cautious, more conservative with your management, which I think, it does make sense. But at the same time, kids, I think, more than adults are sensitive to the effects of being removed from their normal daily life, their normal environment. A kid needs to be in a social environment. They need to be in school learning. They need to be active and sort of engaged in their life. And so you really need to sort of balance that. With kids, another big part of it is typically the activity they're returning to doesn't have as much supervision, especially from a medical standpoint. So in high schools, often there's an athletic trainer or a therapist or somebody who is providing medical coverage at the practices and at the games. In youth sports and in recreational sports and club sports, a lot of times it's just sort of parent volunteers and just parents there. So it can be a little trickier, right? When you're returning somebody back into their sport and they have someone who's dedicated to that team, who's with them, can monitor things every step of the way, and has experience in training, it's a lot easier than when it's sort of parents and volunteer coaches doing it. And so I think on our end, we tend to have them come in a little bit more frequently, follow a little more closely. But I think it doesn't automatically need to take longer, or we don't automatically have to hold them out for longer just because they're a child.
Right. Do helmets prevent concussion? And what properties as a consumer should I be looking for when I do have the option of buying a different types of helmets?
Yeah. So in general, there's not really any helmet that's going to prevent concussion. Our recommendation is usually to make sure that it's a helmet that fits properly and that you're wearing it in the correct way. And the bigger benefit for the helmets is preventing more significant injuries, things like lacerations and fractures and those kinds of injuries. There is probably some amount of force that the helmet is taking away, and so may not prevent the concussion from happening, but over time, if you're taking repeated hits over the course of your career, having a better helmet that fits better, that is being worn properly, over many, many hits can have a significant sort of reduction in the total amount of force you experience.
Right. And can you touch on the role and accuracy of those impact sensors that are now being put into helmets?
Yeah, so we have experience using impact sensors in a research setting, but really the way to think about them is, they can give you some information about whether a big hit has happened. So the best way to really screen for that is just having people watching for that, right? Looking for, did somebody take a big hit to their body or head that you'd be concerned it was enough force that it could have caused an injury. And if you do see that, that's somebody who, even if they seem like they're fine, it's somebody you should check in with. Ask them, hey, is everything okay? It's obviously not at every sporting event that you can have people watching all the time, and there will be things, even for our people watching, that you'll miss. So having the impact sensors, if it kind of buzzes and goes off, says somebody took a significant hit, that can give you a reason to sort of just check in and say, hey, I didn't see anything, but are you okay? Did you take a big hit? How are you feeling? So it's a little extra supervision almost. It's not necessarily helpful at this point in terms of diagnosing the injury or kind of monitoring cumulative hits or anything like that. I think people have the idea that one day it could be useful for that, but right now it's sort of more of a screen for this person might need to be checked to see how they're feeling.
Good to know. My last question is that we've already talked about, that there's a lot of misinformation and misguided information out there on the web and just in general. What do you tell parents? Because a lot of parents will accompany their child to these appointments, and it seems like the parents carry a lot of fear that they've done something wrong or managed something incorrectly in the earlier stages of a concussion, and now that their son or daughter might have permanent brain damage, and should they even continue in sports? And ultimately, where should they go with their child to seek help?
Yeah,
so loaded question.
Yeah, so our appointments with patients take a long time to really get a good history, do a good exam, get the whole story together. It takes time. But then on top of that, a lot of the time we spend with patients and their families is doing education and sort of giving them answers to all the questions and concerns that they have. And one of the biggest things is people often ask us, like, what's the best baseline test to get? And really the better question is to think about, if I were concerned that I had a concussion or that my child had a concussion, where would I take them? Because that's the first step, is thinking about where would I go for care, and then finding out what does that person have in terms of, do they see people for sort of a baseline evaluation? Do I get to meet them and ask them questions? And our baseline evaluations involve meeting with us, having a history done, doing a neuro exam, and then answering questions and kind of education, because I think that's a huge part of all this.
Definitely. And would you say, like, to the parent, what would you say to the parent that asks you, like, is a concussion, like, permanent, will it cause permanent brain damage?
Yeah, a concussion, if recognized and managed appropriately, should have a beginning, should have an end, should recover completely, and that person should go back to having the same quality of life, the same functioning brain that they had before.
Awesome. Good to know. I hope that helps people feel a little bit more at ease.
Sure.
Thank you so much for doing this and agreeing to answering these questions.
Yeah, of course. Happy to.
Awesome. Thank you.